Hi everyone. This summer I have studied about the disaster plan at NYU Langone Tisch Hospital along with my partner Patrick. Just to give you a little background about NYU Langone Tisch Hospital, it is an acute care facility which is located in Manhattan. It houses 844 beds and 3,800 hospital staff. So past disasters like Superstorm Sandy, which occurred in 2012, has emphasized a greater demand for emergency preparedness and the establishment of leadership roles for the execution of procedures. In this facility, the presence of preserved fluids, hazardous material, and its susceptibility for environmental contamination exposes NYU Langone Tisch Hospital to potential threats. Moving on, uh, in the threat and hazard identification and risk assessment, there are potential threats to NYU Langone Tisch Hospital. For the natural causes, there is infectious diseases outbreak, which can be a waterborne or an airborne organism, which causes infectious diseases within the hospital and can also spread quickly. It can affect the patient population as well as the staff. The other natural threat can be that of flooding. As seen from the past experiences, the past hurricanes have caused power outages in New York City hospitals, and sometimes generators have failed, which mandates a supplementary plan for the power grid. We can also see the vaccination or medication storage failure, and the technological threats can be that of fire emergency, in which there can be failed sprinkler systems in the hospital, which can make it very difficult to extinguish fire. And if the fire is near flammable materials, it becomes more difficult to stop it. Um, and in certain instances, like during Hurricane Sandy, there were inadequate equipment and there was supplies failure. So these are some of the technological threats. Human caused threats can be mass shooting, terrorism, and chemical warfare. Moving on, the hospital population and characteristics. There are approximately 844 licensed bed in capacity. 67% of the average number of beds actually are used and staffed in the last 6 months. There are approximately 1,400 clinical staff and 2,400 non clinical staff, which totals 3,800 total hospital staff. Moving on, during times of emergency, communication is ensured with the help of backup generators. So these backup generators will be utilized to power potentially all the damaged lines of communications. Hospital media communication bodies, they inform the public and housed patients of the current disaster, and they also acknowledge the measures that are being put into effect to mitigate the damage. Media bodies also use Twitter and Facebook to inform general public of the known information regarding the disaster and the measures that are happening to overcome it. There is a communication coalition which has the charge to declare a hospital code, which can be code orange or code yellow, which will prepare the staff and the patients for safety protocol. Moving on, in order to have better preparedness, mutual aid agreements are made. Currently, NYU Langone Tisch Hospital has mutual aid agreements with the New York City Department of Health and Mental Hygiene, with the New York City Department of Environmental Hygiene Protection, with the Federal Emergency Management Agency, and NYU Langone Brooklyn, NYU Langone Copple Hill, NYU Langone Philthrop. In terms of an emergency, there has to be some emergency power generation. So, fortunately, NYU Langone has its own energy building, which is located at East 33rd Street and FDR Drive in Manhattan. It is a centerpiece of NYU Langone's Resilient Medical Center program, and it is self sufficient and can maintain full power. There is no refueling, which is necessary, and it powers life safety, full facility, and power elevators and critical branches. The source of facility water is the community one, and there is a secondary source if the primary source is cut off. Moving forward, uh, the hospital operations are continued even at the times of disaster, and it was last exercised in the blizzard of 2018. The three priority functions that are exercised are the restoration of delivery of urgent and emergent care, restoration of critical infrastructure, and restoration of communications or IT. Moving forward, there is a hospital emergency management community committee that meets every quarterly, and this community is multidisciplinary. It forwards critiques of all the drills to appropriate services, and it also sends action reports um, after action reports to the governance of the hospital on community planning and exercises. Moving forward, uh, during the times of emergency, NYU Langone can both send and receive emergency warning and notification information. It also has a plan to notify both on duty and off duty staff on emergency status. Staff notification was has been tested in the last 6 months. Staff can also receive warnings from the digital emergency alert system by either voice or text messages on their wireless phones. It also has an updated list of the volunteers so that it can deploy the volunteers during an emergency. Moving forward, this is the hospital evacuation guide for NYU Langone Hospital in terms of when there is an power outage in New York City. It is advisable to take shelter in place. More information is obtained, and as a result of which, because of the power outage, there is the lights and power are limited at NYU Langone. Therefore, the emergency rooms are closed. It's ensured that the generators are working, the elevators are cleared of people, and the priority is given to patients on life support and who need power for support. And in all this, emergency management team plays a very important role. Moving forward, um, some of the annexes that I think should be included in NYU Langone disaster plan are a comprehensive disaster plan, which includes plans for evacuation of disabled people. There should be training and preparedness against antimicrobial resistance, which is becoming more prevalent these days. There should also be preparedness plans for anthrax, which is still unsolved. There should be 100% disaster preparedness trainings for both clinical and non clinical staff. There should be better mitigation planning for active shooter situation. So, this is a summary of the things that I've learned from this course. Um, it is that one can never be fully prepared for a disaster. Therefore, all the possibilities should be considered. Special emphasis should be given in planning for the evacuation of vulnerable population like disabled people. Timely disaster preparedness training should be taken place at the facility and it should be ensured that all the staff completes these trainings. First steps in a disaster are really important and thus the staff should know exactly what to do if the situation arises. Communication with mutual aid partners is really important and NYU Langone should maintain good relationship with them. There should be a culture of disaster preparedness in the whole community. Here, I end my presentation. I hope you enjoyed it. Thank you.